So next I want to talk about the Health Care Proxy. I talked in an earlier video about the HIPAA rules, which says that your medical information is kept private. And so what you need to do to avoid this problem is to set up a Health Care Proxy. This is a legal document that designates an individual as the person allowed to make medical decisions on your behalf if you are not able to speak. So remember, if you're in a hospital and you're conscious, the doctor's going to ask you what you want. Your family members can be involved in the decision, but ultimately it's yours because you're able to speak. But if you're not able to speak and you're unconscious or you have dementia and you can't meaningfully understand what's going on, then the doctor decides. Unless your family member has unless you've set up a healthcare proxy saying that this person can make medical decisions. So that's where they make the do not resuscitate orders and all the rest. And they can also get your medical records. One other thing I'll state about the healthcare proxy, you got to pick somebody that you've discussed your wishes with. Because the issue with the healthcare proxy is the person selected ultimately can do what they want. Even though you can say in a living will, I don't want a feeding tube. If your child, who's your healthcare proxy, puts the feeding tube in you, tells the doctor, okay, go ahead, they're allowed to do that. Nobody can sue to remove the feeding tube because the healthcare proxy allowed it. So the living will, your wishes are only your wishes, but it's ultimately the healthcare proxy that makes the decision based on the information at that time. So it's always best to discuss with your healthcare proxy what your wishes are so that they follow them.